Good afternoon. Earlier this morning, I attended a service to celebrate the life of Officer Brianne Leith. What an incredible human being Brianne was and public servant. She wore 3 different uniforms. She served in the Indiana Army National Guard. She served and wore the uniform at the Department of Corrections here at the state, and then ultimately realized her lifelong professional dream and served with her brothers and sisters at the IMPD. She had a profound impact on everyone that she came into contact with, way beyond her incredible smile. She had such an influence on her coworkers and inmates at our Department of Corrections. She oversaw the We Ones program. And I've asked the commissioner of the Department of Corrections, Rob Carter, and our chief medical officer, Dr. Doss, to come up and share a few words about how we here at the state of Indiana are going to continue to make sure that Brianne's legacy lives forever. And I would just ask that you also keep Tom and Jennifer, her parents, Tiana, her sister, and Zane, her son, in your thoughts and prayers as the days and weeks and months and years ahead unfold. Rob?
Thank you, Governor. My team was blessed to have several minutes of video footage from a documentary that was filmed at the women's prison a few years ago. In the footage, you're going to see there's some additional footage that she really talked about her son, talked about being a mother, being a future mother. She talked about respect and admiration for her dad, who was a police officer. And coming from a family of police officers myself, that touched me personally. She talked about her goal of being a police officer someday. She was hardworking, dedicated, kind, and compassionate. I could go on, but what really stood out for me was she truly cared about the babies and the mothers in this program, and she treated the babies like they were her own. There's no doubt in my mind that she was a good mother, and that's the best compliment that any of us can receive as a parent. In the special little nursery, if you can imagine, these babies are born in a prison, and they spend the first few months of their lives in a prison. So we felt it would be highly appropriate for us to rename this nursery after Officer Leith, and hope these babies that are born will use her memory as an inspiration.
On behalf of Indiana Department of Corrections, I want to introduce or announce and dedicate the We Ones Nursery to Officer Brianne Leith in her honor. Thank you.
How's the baby? Your skin looks amazing, little girl. And this hair.
When did she go out again?
She should go for her monthly checkup.
So they already said her levels are they're all down. She's fine.
Hi. Hi. She's just looking. Do you feel better? Huh? You feel better?
She is so beautiful. Oh, she's so cute. I hope my baby's cute.
Well, I hope that not just during this time, but in the coming days, as we all together as a state work our way through this pandemic, that we bring an equal amount of passion and compassion as Brianne did every day that she came to work. And with that as a and your other job as an OBGYN. That's got to be pretty touching to you as well, but
Makes me miss my profession just a
Well.
little bit, sir, my old.
I can only imagine, but don't go anywhere.
No, planning on.
This is our daily doctor's appointment, so you want to give us an update on where we are?
Thank you, Governor. Today, we reported 611 new cases of COVID-19, and unfortunately, an additional 41 Hoosiers who have died of this disease. We also had 2,735 new tests reported to us, and have now had more than 51,000 Hoosiers who have been tested for the novel coronavirus. You can also see the deaths that we've had per county, and as you can see, the number of tests that we've had per county has increased to over that 51,000. When we look at our availability for ICU beds, we can see that we still have about 45% of those beds available, with about 24% that are being used for COVID-related patients, and about 32% for non-COVID-related patients. And when we look at our ventilator patients, we still have about 76% of our vents available, and about 14% of those being used are being used for COVID-related patients, and 10% for non-COVID. So these are amazing statistics. They've remained very steady, and we're very pleased to see that. We reported earlier this week that we had an offender at Westville Correctional Facility that had died of COVID-19. We're seeing an increasing number of cases in jail and correctional facilities across the state. We now have greater than 80 offenders at Westville that have tested positive, and our strike teams have been conducting testing in 2 other facilities. I know that our facilities are isolating the symptomatic individuals and positive individuals, but I want to emphasize how incredibly important it is for staff to take all the precautions, including wearing their masks and practicing good hand hygiene. Like any congregate living situation, our correctional facilities are ripe for rapid transmission of COVID-19. We have to do absolutely everything possible to limit the spread of this infection to our vulnerable populations. I also want to provide an update on our healthcare reserve workforce, those volunteers, over 14,000 of the individuals who completed our original survey. Already more than 4,000 have been matched to requests within healthcare systems, and those include 4,062 healthcare reservists and 382 student volunteers. We're continuing to survey these volunteers on a weekly basis and currently have 6,454 available healthcare workforce reserve available to work part-time or full-time. So if you're a healthcare system with a need, please reach out through the healthcare facilities, have received contact information on how to reach us, and we will connect you with those volunteers so that we can make sure we're helping you with your workforce needs. Finally, I want to give you the latest update on our drive-through clinics. Through 3 days, we have tested more than 1,300 people in 4 locations in Evansville, Fort Wayne, Gary, and Sellersburg. That brings our total number tested through drive-thrus to more than 2,200 individuals when we add the Maryville drive-through clinics in this past week. We're still calculating the positivity rates, and we'll hope to be giving you that information in the next couple of days. I want to thank everyone who has helped with these testing efforts. We could not have done this with just our staff alone, the Indiana Air National Guard, our local health departments, and even local businesses who came out and brought lunch and other things to our group. So thank you very much for all that support. Governor?
Thank you, Dr. Box. Fred, it's Thursday, which means you've got some very timely updates.
We continue to experience extreme volumes of claims filings in Indiana, just like we are experiencing around the country. The most recently reported week, the week ending April 11th, we experienced and we saw 118,184 new claims successfully filed in Indiana. That number is slightly down from the previous week, but it still posts one of the highest weekly totals of unemployment claims filed in Indiana history. In the month of April, from April 1st through April 15th, we paid out a total of 432,740 unemployment insurance payments. Now keep in mind, for the entire month of April in 2019, we had 71,000 total claims paid out for that month. So I want to talk a little bit about Uplink. Uplink is our unemployment insurance system that actually pulls in the claims and people can file the claims through our Uplink system. We've made a variety of changes to our Uplink system over the past few years, and our Uplink system is really holding its own, and it's really handling the extreme amount of claims that are being filed. But along with extreme amounts of claims come extreme amount of phone calls. So one of our greatest challenges remains the high call volume, just like with any other state in the nation right now. In fact, so far for the month of April through April 14th, we've seen over 800,000 phone interactions. Specifically in Indiana, two of our top challenges with our high call volume. One is wait time, and the other one has been dropped calls. We've identified the cause of our dropped calls, and we're addressing those now. We've implemented a new callback feature, and individuals are taking advantage of that new callback feature now. We are seeing the metrics trending in the right direction for our call center. But one thing that we know is that those metrics aren't moving fast enough, and that not enough Hoosiers are feeling the positive effects of those metrics. So we're going to continue to work on this. We're going to continue to make adjustments as we go. And we continue to ask that you be patient with this system, because with this extreme amount of calls and this extreme volume, our system is being taxed, and we're trying to make sure we make adjustments to better serve Hoosiers. Now I'd like to give an update on our pandemic unemployment compensation and our pandemic unemployment assistance programs. First, I'll talk a little bit about the pandemic unemployment compensation. As I reported some time ago, individuals should start seeing those pandemic unemployment compensation payments begin the week of April the 20th. We're a little bit ahead of schedule right now, but we will have a slight inconvenience this evening. From 7 p.m. through about 10:30 p.m., we will take our Uplink system offline. We will take it offline to update it so we can have an implementation of our PUC system. And as a result of those updates, we will begin dispersing payments on tomorrow. We believe that this small inconvenience of 3 hours is worth us providing payments a few days earlier to those individuals on our unemployment compensation system. Now, as a reminder, our PUC payments, that is a $600 weekly payment amount that's provided to individuals who are eligible under our regular unemployment compensation program. Now I'll give a little update on our pandemic unemployment assistance program. This is our temporary unemployment benefit program for a new classification of workers, those independent contractors, gig workers, those who are self-employed, etc. Now, as we reported before, we are building a completely new system to administer these claims. But right now, I'd like to talk about large-scale IT projects. Any large-scale IT project, which is what this is, go through about 4 different phases. Those 4 phases include planning, construction, testing, and release. So those are the 4 major phases that large-scale IT projects or systems go through. Now, we have 2 processes that are going simultaneously right now. One process is our application acceptance process. The other one is the payment disbursement process. I'll talk about each one of those separately. First, the application acceptance process. In that process, we are in the construction phase right now. And essentially, what the application acceptance process is, this is the creation and the coding of the infrastructure and the forms needed to actually accept applications into a system. Now, we have a target date for release and to open up this application acceptance part of the system for April 24th. Remember, that's a target date. And on that target date, we'll be able to accept PUA applications under this new system. For those individuals who've already filed under our current system, you'll be receiving an email for further instructions. Now, on to the second process. The second process is the payment disbursement process. We're a little further behind on the payment disbursement process. And essentially what this process is that it consists of gathering and collecting different types of financial information, and we actually get that together and it tabulates that data, and then it actually disperses a payment to an eligible individual. Right now, we have a target date for release and begin making payments on May 4th. Again, these are target dates. One thing that we all know with large-scale IT projects, there could always be delays. But based upon the information that we have at the time, those are two good dates for us. Remember, application acceptance date, April 24th. Release date, disbursement of payments, May 4th. Now, we are primarily focused right now at the Department of Workforce Development on making sure that we are administering the unemployment insurance benefits to those in need right now. That's our focus. But while at the same time, our agency does have a responsibility to connect people to training, to connect people to jobs, and to connect employers to skilled workers. There are employers around the state who are seeking employers right now. We're planning virtual job fairs in conjunction with our regional offices throughout the state. If you want to know more about the virtual job fairs that we're going to have, feel free to go to www.dwd.in.gov and scroll down to the DWD News section, and it will give a list of the virtual job fairs and the other information that may be relevant to you. I also want to remind people that if you're looking for any open jobs, you can go to indianacareerconnect.com. That's indianacareerconnect.com. Finally, I want to mention our Rapid Recovery Plan. In our Rapid Recovery Plan, this is essentially an accelerated action plan to support Hoosiers in securing jobs, growing skills, and developing talent when we find our way out of this pandemic. This is a joint effort with the Governor's Workforce Cabinet and partners like Strata Education. Our goal is to make sure that we come out of this pandemic stronger than when we came in it. That's what Hoosiers do. We go into a situation one way, but we come out of it stronger. So we're in this together, and we plan to make it out of this together. Thank you.
Thank you, Fred. June 2nd, primary election day is right around the corner, and we are prepared, and I understand you've arrived at, with all the stakeholders, some consensus here recently, and you want to give us an update on the election that's coming.
Absolutely. Thank you, Governor. Thanks for all you're doing for our state. I'm pleased to announce that together with the Indiana Republican Party Chairman, Kyle Hupfer, and the Indiana Democratic Party Chairman, John Zodi, my office will be making further recommendations to the Indiana Election Commission regarding the June 2nd primary election. The Commission will be meeting virtually tomorrow on Friday, April 17th at noon, and you can find the Zoom meeting information on the Indiana Election Division website. These recommendations come after many discussions with county clerks and election staff, the state parties, the Indiana Election Division, and they represent what we believe to be best practices for an unprecedented election cycle. You all know that on March the 25th, the primary election date was moved from May 5th to June the 2nd. And at that time, constraints around absentee vote by mail were lifted. And as of this morning at 7:30, over 70,400 voters have requested an absentee ballot. Any registered voter can request an absentee ballot by mail, and it's very easy. You call your county clerk and request an application be mailed to you, or you can go to indianavoters.com to print an application, Fill it out, sign it, and return it to your county. And remember, May 21st is the deadline to request an absentee ballot. Early in-person voting will take place. It's a limited time period. It's normally 28 days in our state. But starting May the 26th, the Tuesday after Memorial Day, and until Saturday, June the 1st, we will have in-person early voting. I would caution you, please check with your county as locations may be different than past locations. In-person Election Day voting will take place on June 2nd. And again, check with your county because locations could be different from past elections. The Indiana Election Commission will also, their order will also be accompanied by health and safety information for counties. As recommended by the Center for Disease Control, we plan to address the potential coronavirus threats by minimizing direct contact among Hoosier voters and election staff, educating poll workers on sanitation best practices, and ensuring polling locations are supplied with the necessary personal protective equipment, all while maintaining the highest standard of election security. The Indiana Election Commission order will also give counties flexibility in establishing precinct and vote center locations as well as central count locations. Indiana is applying for the federal election COVID-19 funds in the amount of $7.9 million. We are using that money to purchase masks, gloves, hand sanitizer, cleaning and disinfecting supplies for voting systems, electronic poll books, and general services. And we will be distributing those supplies to counties. Federal and state dollars will also be used to communicate important information to voters, like deadline to register is May the 4th, encouraging people to vote by mail, and the deadline to request a ballot, again, is May 21st. Also, those ballots must be received by the county clerk by noon on Election Day. We will also be using social media to recruit high school students, college students, and the recently unemployed to represent their party at the polls in an attempt to recruit younger election workers. Voters and reporters alike should prepare for delayed primary results. Some clerks may be operating with reduced staff or unfamiliar resources, and the volume of absentee ballots may require counting to last longer than normal. Again, I want to thank Chairman John Zodi, Chairman Kyle Hupfer, the Indiana Election Division, Indiana's 92 hardworking county clerks, and the Indiana Election Commission members for their work on this issue, and especially Governor Holcomb for his continued support. You know, we have never experienced anything like this before. But I have to tell you, I am very encouraged by what I am hearing from election workers around the state. We're going to keep marching forward, and we are going to make sure that Hoosier voices are heard on June the 2nd. Thank you.
Thank you, Secretary Lawson. Proud of all that you've taken on and all that you've executed in setting us up for a safe and secure election on June 2nd. Let me just state the obvious. We live in a patriotic state, long have. One of the benefits of that is we've been able to enjoy a strong National Guard presence. And it's always been the case. We're known around the country as one of the top Guard states in America. But it's never been more obvious on the ground in our state, I think, on a perpetual minute-by-minute basis than what we're going through together right now, and the Guard's oversized influence in this whole execution. And I just wanted to say thank you to Adjutant General Lyles for leading this effort on the ground. These folks, about a month ago, we activated the Guard and we sent out about 900 guardsmen. And these are folks that have, by definition, another job. And they have packed, unsorted, delivered, and food to all these, various 12 different food sites that end up going to food banks, that end up going to food pantries, and making sure that families that are hungry are receiving the food and nourishment that they need to get to that next day. Obviously, They're trained to do this, but this is a joint exercise. Fred, you mentioned this was a joint exercise in your arena, but they're working with our state police, and they're working with NDOT, and they're working with the Department of Health, and it's just hand in glove. And we would have been much slower out of the gate had not they trained and practiced and planned and trained more to put us in this position to where we're playing offense and turning and burning on a daily basis. So I just wanted to take a few moments just to say thank you for this military precision that's being implemented and executed on a daily basis. Also, just a couple quick items before we get to the Q&A portion. Earlier today, about 2 p.m., a number of states, mostly Midwest, all Midwest states, Minnesota, Michigan, Ohio, Wisconsin, Illinois, Kentucky, and Indiana signed on to jointly as well make sure that one another, our neighbors, are informed about the actions that we're taking. We're sharing information. We've been doing this. Indiana's part of that group, and then also, I'm also, as I've mentioned in some of these in the past, working with Ohio and Kentucky also on that, primarily that southeastern quadrant of our state. And so you see this, if the trends continue and we continue to make progress, we're all thinking about that smart restart opening of our states in a very gradual, methodical way if the numbers continue to hold and the trends continue to hold. So just wanted everyone to know that we're not just talking to ourselves. Our general counsel and our health department and our staffs are also, in addition to me talking to my cohorts on a regular basis, we're starting to formalize those discussions in a much more regular way. Also, earlier today, I sent out a letter requesting input from a lot of our major associations representing our retailers, our manufacturers, our medical device association, construction industry, tourism, realtors, sports and cultural events, large gatherings, each asking them by the 22nd of this month, so that's next Wednesday, to get us their recommendations, their suggestions on modifications, changes that they'll make in the workplace that will encourage and give their employees a high sense of confidence that this is a safe place to go back to work. And so we're asking for that by the 22nd of April so that we can, in May, hit the ground running and not have to hit the pause button. We're doing our work right now. So we'll continue to be driven by the data and the numbers and what's actually happening. You'll get those daily inputs every day. But in the meantime, underneath the surface of the water, there's a lot of work that's happening. And with that, Rachel, we'll go right to the Q&A.
Adam Van Oostel, Hannah News.
Hello, Adam. Good afternoon.
Good afternoon, Governor. Ohio's governor, I think, just announced today that they plan to start reopening the economy May 1. How does that date sound to you, and do you think that that would be possible here in Indiana?
Well, I just talked to the governor earlier today. We're both thinking about May. I'm not being date specific. I'm going to be looking at the numbers. We've said all week long here in the state of Indiana that these next few days are very important to us. We want to see this trend hold. We want to see the numbers hold. We want to make sure our capacity is where it is and continues to improve, quite frankly. So I'm not putting May 1 date out there, or May 2, or May 7, or May 8, but we are thinking early May.
Elizabeth, PBS, Michiana.
Good afternoon, Elizabeth.
Good afternoon, Governor. Today, Indiana's U.S. Senator Mike Braun announced his appointment to the White House Reopening the Economy Committee. And I wanted to know if you will be calling Senator Braun to talk about how Indiana can best coordinate with the White House? And I also had a question for Secretary Lawson, which is why did the state decide to use the $7.9 million in federal funding on masks and gloves and safety equipment rather than opting for a vote by mail primary in 2020?
You want to take that first, or you want me to go first? Yeah, okay. Yes, I will call Senator Braun. We talk, we keep in contact, not just one-on-one directly, but our staffs do as well. I share his sentiment. We want to make sure that we restart in a safe fashion. And he's seeing the numbers that we're seeing. And with these improvements means we need to be planning accordingly. I'm actually going to be jumping on a call with the President of the United States. I'll jump on about 30 minutes into the phone conversation because I'm going to complete this first. But there's a call today at 3 p.m., the President with governors all over the country. And we'll learn more what's on the President's mind as well. And then we'll continue to, as we have from day one, working with our entire congressional delegation, including, as you saw, Senator Young in here yesterday with us and with Senator Braun.
So we are applying for the federal COVID-19 election funds, the $7.9 million, and we have purchased a number of, or contracted for a number of personal protective equipment. I want to say first that we've been very deliberate and careful not to solicit vendors who supply critical care needs or interfere with those supply lines. We have made it much easier to vote by mail in Indiana, but I also have to say that it's what we have done is we've made the process easier to request an absentee ballot. So it's really not a departure from the norm. It's just an expansion of an existing process that clerks have been doing for years. That's the way we chose to spend that money, and we'll continue to protect our elections. I mentioned also in my remarks that we'll be doing PSA announcements to reach out to voters, to recruit younger poll workers to represent their parties on Election Day. So I think we're putting the $7.9 million to good use, and we'll continue to look at better ways to improve our elections.
And Rachel, if I could just add something to Elizabeth's question. Very important what Senator Braun and Senator Young have shared over the last couple of days about our federal partnership. There are also committees that have formed up around the state of Indiana, and we're working with them as well. Town managers, mayors, county commissioners, that local, state, and federal partnership. Connie has just articulated how we can be effective with our federal partnership down to the county clerks and the state's role in that as well. So yes, the committees that are forming up to get back to work in our nation's capital in Washington, D.C., very important, as is the state capitol and every county seat in Indiana.
Emma Kate, Chalkbeat.
Hello, Emma. Good afternoon.
Hi, Governor. I wanted to ask you about the Governor's Emergency Education Relief Fund money. Have you applied for that yet? And when do you expect to see that money reach the state? Also, I understand that governors will have a few options for how to distribute that money, and I was wondering which you're planning to use.
Yes, and I've tasked, and I see Chris walking up to the podium right now, our budget director at OMB. You want to elaborate on exactly where we are right now and then what we're thinking about, how we're working with the Department of Education and CHE, et cetera?
Yep, absolutely. If you'll remember when we talked about a lot of the federal relief package and the Education Stabilization Fund, there are three separate buckets for that. And the one bucket goes directly to K through 12 school corporations in the state of Indiana. Another bucket of funds will go to our higher ed institutions. And the third bucket, approximately $61 million, which you asked about, is the governor's emergency fund. And that can be used across the spectrum of both K through 12 and higher ed institutions. And it's really to promote and assess how we can promote remote learning. And so it is an assessment of not only the technology that is available or is not available, but then also getting those teachers up to speed as far as being trained to conduct remote learning. As the governor mentioned, we've had several calls with the U.S. Department of Education and as well as the interaction with the State Department of Education and the Commission for Higher Ed to figure out how best to utilize those funds. We have not filed the application because we want to put that planning document, include that as part of our submission.
Thank you, Chris. Thanks, Emma.
Brandon Smith, Indiana Public Broadcasting.
Hello, Brandon. How are you?
I'm good, Governor. How are you?
Thank you. Good as well.
This is a question for you and for Secretary Lawson. With the President of the United States, among other top Republican officials, saying that vote by mail isn't a safe way to conduct an election, are you worried that Hoosiers are going to hear that message and be scared away from participating in the process?
We've long been voting by mail. I have a high level of confidence in the integrity of our election process.
Thanks, Brandon, for the question. As you know, in Indiana, any voter has to have a voter ID, and that ID record is linked to the Bureau of Motor Vehicles. And every county clerk has the ability to check a voter's record. And, you know, our trends in this state have grown since we passed the opportunity for people to vote early in person. The trends are that early in person in voting has been increasing over a number of years, and also so have the absentees. So again, we're continuing with the norm. It's an expansion of a process that the clerks have done for years. So I feel good about the process here in Indiana.
Yeah, Brandon, we'll have a safe and secure election.
Mary Ann Ahern, NBC, Chicago.
Hello, Mary Ann. Good afternoon.
Hi, thank you so much for taking my question.
Sure.
You talked about the prisons at the beginning, Dr. Box, but I wanted to ask, because there are so many staff members who obviously live in neighborhoods near those prisons, and there is fear that that is creating a public health hazard. Some of them have just received those masks this week. They're certainly not wearing N95s. They have not all been tested. Would you consider a lockdown to ensure social distancing? 500 inmates at a time line up for meals, 400 to 600, for daily meds. Folks in those communities, especially in Northwest Indiana near Westville and Michigan City, are very, very concerned.
You want to let
I see Commissioner Carter.
And then we'll go back to you too as well.
Yeah, we've had to change the way we do business, and as far as our meals go, they move in cohorts. The meals are staggered, and we're doing the best we can as far as that goes. I can't speak to those on the outside that may be infected, but we have our offenders that have tested positive. They are quarantined. They are isolated from different parts of the facility. And if you're talking about Westville, that's just one dorm, although there are quite a few that are positive in a single dorm. Again, and also the PPE. We have been working on our own PPE for weeks, and we started in probably mid-March making it before anybody else was making it because we wanted to take care of our employees first and our staff and our inmates before we took anything from a supply that had to go to healthcare, medical personnel, or first responders. And we have been rolling that out, and we feel like we've got every facility equipped with masks and with PPE now.
Thank you. Anything you'd like to add?
Just to say that I think Dr. Doss has done an amazing job to identify any guard that had been in and out of this particular unit, and every one of those guards will be tested so that they know not only that they could be at risk for infecting someone else in the facility or another guard, but also when they go home to their families and to their communities, because that's very important. And Dr. Doss has been incredibly vigilant about making sure that these individuals get appropriate medical care. We spent a good part of this morning on the phone with hospitals in that area, just letting them know about exactly what's going on in case we need services, and even have actually reached out to EMS in that area to make sure that they know that there may be increased calls and how would we divide that up. So I think that the Department of Corrections has done an amazing job making sure that we've covered all the bases.
Mary Mills, WTHR.
Good afternoon, Mary.
Hello, Governor. I have a question for Dr. Box and Secretary Lawson. And Secretary Lawson, I'll start with you. Marion County has encouraged voters to vote absentee for safety reasons. Wondering if you too would encourage that. And also, I presume you're expecting a big jump in absentee votes, and I'm wondering if you have any idea by how much.
Well, I will encourage voters to vote absentee, and I've been doing that for weeks now. And we do plan to do some PSAs and continue to encourage voters to vote absentee. But, you know, the fact of the matter is there are some people that feel very, very strongly about voting in person. And so we also have decided that we would cut down the number of days of early voting. So what it really works out to, because we didn't want to have in-person voting only on Election Day because we felt like that would be too many people congregating at the same time. And so that's why we have instituted early voting. So what it totals to is about 8 days of in-person voting. Hopefully that will spread the number of people in any one location out so that, you know, there won't be close contact with poll workers and election workers and the voters at the same time.
Okay, my question for Dr. Box is, earlier this week, I think you said that allowing long-term care facilities to move patients to other facilities and also across county lines was not only scientifically sound, but that it would protect residents from getting COVID-19 and improves the quality of life for those who tested positive. But the county health officers we've talked to say they're not quite familiar with the science you were referring to, and they say that a lot of studies show residents often fare poorly when moved. Can you just tell us kind of what studies or specific evidence you were referring to when you said that the order was scientifically sound?
So I want to reemphasize the fact that I didn't take instituting this order lightly. I have greatest respect for our local health officers and public health in our counties and have worked well with them in the past. And I did speak with both county health officers that were involved in particular orders that were contrary to this particular order that I put out. Centers for Medicaid and Medicare Services, along with the CDC, has made it clear in their recommendations that it is very important that we have the avenue to discharge patients from the hospital when they're COVID positive to facilities where we know that they can be cared for safely and they'll be able to get back on their feet. Many people will not be able to return to their home because it will take a while for them to feel better, especially as they're usually more elderly. It's also very, very important that individuals that are COVID negative, when many people that we test in their facility are positive, have the opportunity to be moved to another facility or another branch of that facility and still be quarantined as long as they've tested negative so that they have a decreased chance of becoming infected with COVID-19. That's what I would want for my parent or my grandparent or anyone else in my family. So that's what we hope to do. With regards to isolating specifically, I was talking about individuals that are maybe in a memory care unit and the difficulty that they have sometimes when they become totally isolated. And in talking with Department of Aging, the ability to be able to have more social stimulation for them if they're in a unit that's completely COVID positive and being cared for by individuals that may be COVID positive or actually have gotten over their disease. That can be ideal in the circumstance that they can go on and have congregate meals and still have that stimulation.
Marcus Green, WDRB, Louisville.
Good afternoon, Marcus.
We'll return to Marcus. Lindsay Erdody, Indianapolis Business Journal.
Hello, Lindsay.
Hello, Governor. My question is for Secretary Lawson. I'm curious, still having in-person voting those early days and on Election Day, you'll need to recruit poll workers still. So what steps are being done to do that? And have you heard from counties? Are they worried about being able to recruit enough workers?
Well, we have heard from counties, and they are having some difficulty recruiting poll workers, and that's why we plan to help them recruit high school students, college students, and recently unemployed people with our outreach. We had a call this morning with our, and we've redone all of our, we always were doing election outreach, but we've honed our election ads, and they'll be starting very, very soon.
We return to Marcus Green.
Hello, Marcus.
We'll work with Marcus offline. Rob Burgess, the Wabash Plain dealer.
Afternoon, Rob.
Afternoon, Governor. Secretary Lawson, I wanted to return to vote by mail. By the postmaster's own account, the Postal Service will be out of funds by September. How will vote by mail commence during the general election if there is no mail through which to vote? And what about switching to digital voting, given how often people do things like filing their taxes electronically? And then Commissioner Payne, I know you've mentioned this before, but could you go over self-employed people applying for unemployment? I've heard reports that people are being denied or are still waiting on a response. Thanks.
Well, you've asked a lot of questions in one statement. Let me just start by saying that I have no reason to believe that we will have problems with the mail in November. If we do, we will have our elections as normal. If we have to limit vote by mail or absentee possibilities, I think that we could do that. However, remember that Indiana is not a vote by mail state. We vote in person early for 28 days, and we vote on Election Day. And so we will work around the Postal Service issues as they arise.
So with regard to the pandemic unemployment assistance, the portion of the act that pays for the independent contractors, those individuals who are applying under our system now, as mentioned earlier, they will receive a denial. But what we've done is we've updated our system to make sure that we're reaching out to those individuals who've applied already. If they've not received an email from us, they will receive an email from us at some point in the future, letting them know what next steps they need to take. In many of those cases, they probably need to give us some updated information, which will be applicable to the new system that hopefully will go online on April 24th.
Stephanie Zeppelin, Wish TV.
Hello, Stephanie.
Hello, can you hear me, Governor?
Loud and clear.
Hi. So President Trump has said that he wants to announce today that he's going to open the economy back up. I know you're working with some other governors. When you say relaxing the regulations or opening the economy, I mean, I assume it's not just going to go from 0 to 100.
You are correct.
Do you have any ballpark as to how you might ease it open or what people might expect? I'm assuming we're not all going to a Colts game next week.
Right. No, it'll be a very methodical, data-driven, rolling, gradual, incremental process. And so it won't go from 0 to 100, or it won't be like flipping on a light switch where everything is immediately back to normal. We didn't arrive here overnight, and we're not going to get out of the woods overnight. That's exactly why, though, we want to gather all the economic information right now in terms of that economy coming back online through our various sectors in the state of Indiana. So all that hard work, all that work is ongoing, has been, but will become even more intense from today through that May time period.
Nikki Kelly, Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon, Governor. I was wondering, earlier from the Indiana Election Commission said that they were going to look into applying online for the application. And so it doesn't appear that we're going to be doing that. And also, was there any consideration given to mailing out an application for absentee ballot to all registered voters?
Thanks, Nikki. We cannot afford to mail an application for an absentee ballot to every voter. We felt like we could spend our money more wisely in other ways. And what was your other part of the question? I'm sorry.
The Indiana Election Division.
Yeah, the absentee ballot application. We're about a week away from getting that online. I didn't mention it in my remarks because it's not up yet, and I didn't want people looking for it today. But we are within a week, week and a half at most, getting an application online, so it would eliminate a process. So instead of calling the clerk's office and have them mail an application, fill it out, mail it back, and then the clerk mail the ballot, we will have that application online, and it will eliminate that first 2 mailings. It will eliminate the requirement to mail the absentee into the clerk's office and then to have them mail it back to you. So we're excited about that. It's gonna really make the operation, I think, in the clerk's office a lot more efficient, because that application will then immediately be in their hopper, we call it, the next morning or that day. So yes, we are developing that as we speak.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. I was writing a cheat sheet and wasn't paying attention. I apologize to you folks.
You're a multitasker.
A couple of things. First of all, we found these daily news conferences to be extremely helpful and get information. Are there any plans in the next couple of weeks, Governor, to do maybe sort of a statewide, sort of virtual town hall where you, your staff are there to address all the citizens of Indiana? Because I know a lot of us will get questions from readers and viewers and listeners that we just can't get to, number one. And number two, Dr. Box, is there any intention, or would you folks in the health division be willing to share some of the models that you all look at with us in the media, so we can kind of see the same thing that you folks looking at, so we can better inform our audience as to, here's what the Department of Public Health says. We look at, the University of Washington model, or, the IUPUI model. So we all have sort of the same mutual point of reference to look at.
Yeah, we'll continue, Abdul. Look, don't restrict yourself to this hour, 2:30 to 3:30, to have your questions answered. We're open 23 other hours a day too. We're working around the clock and managing our way through this, I would say fairly successfully. But yeah, we'll look at all kinds of ways to get the communication directly to your subscribers, your viewers, your members. We're working with, like I mentioned at the very outset of this, doing phone conferences every day with groups. So anything's on the table, but we got to maximize our time every day to keep making the progress while we're right in the middle of this storm. And dare I say, getting on the other side of it. And I think he had a question for you, Connie. Abdul, did you have?
It was for me.
Oh, I'm sorry.
It was for Dr. Box.
I was hoping Connie was going to take it, but
Dr. Lawson.
We do look at several models, as I've discussed, and we review those every Thursday and look at them. They do change every week, every day, and we're not just looking at models for the entire state. We look at models for all different regions, because the state of Indiana does not have everybody at exactly the same place. So I don't think that's something that we would be sharing, because that would be a snapshot in time for a particular area and wouldn't really be all that helpful.
Our final question is from Kayla Sullivan, Fox 59.
Good afternoon, Kayla.
Good afternoon, Governor. So I want to talk a little bit about grocery store workers. Large chains like Kroger have asked to be deemed extended first responders or emergency workers for the purposes of getting more PPE access. I say PPP all the time now. So PPE. And what is it going to take to get places like hair salons open back up? I know there's a petition going around to possibly allow them to make it one person at a time while wearing masks and gloves. Would that kind of fall under some of the ways that you're working with certain companies to come up with their own plans? Do you like that plan to let one person in at one time? What are your thoughts?
Well, that's what we're working through right now, Kayla. Obviously, we're going from kind of a shift in thinking from essential to non-essential to how you do business, when you do business, who you do business with, how many people, so it's a long list of factors that we'll contemplate and crunch when we roll out that next executive order. And you might want to talk about our specific questions about grocery store workers, how we prioritized that front line.
So even though our personal protective equipment is getting better, we're not at the place that I can even give personal protective equipment to every community health worker that's going into homes and taking care of our elderly people that may have congestive heart failure or diabetes or other things. And I really, have encouraged them to use those masks that are made by local churches or by themselves. I would love to have masks to give to everybody, but I would really encourage those essential workers like those in food markets to be able to make those masks and to use those masks. And again, it's not just about the masks, it's about the hand washing that is so critical.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be tomorrow at 2:30 p.m. Eastern.